Welcome, and thank you for joining Planet PCR. I'm happy to welcome Dr. Pedro Lemos, who's calling in from Sao Paolo, Brazil, and Dr. Nestor Mercado, who's calling in from Albuquerque, New Mexico. Thank you for joining. Let's start with you, Pedro. Welcome again. Good to see you. And tell us a bit about how is the situation of the epidemic in your lab and in Sao Paulo?
Well, William, the peak of the crisis has not reached us yet. We had the first case in the country in the beginning of the year, so it's increasing now. But, you know, I work in a 600-bed hospital. We already have 120 patients with COVID in the hospital, around 60 in the intensive care unit, and it's increasing. So, yeah, we get ourselves prepared, but the peak is yet to come.
So you are pretty close to the, the big wave, actually.
Yes, well, the expectation is to have it in 1 or 2 weeks, perhaps.
Okay, yeah. And what about you, Nestor? Is it the same situation in your environment?
It's a little bit different here, William. We are geographically located in the southwest part of the United States. So the entire state is not very populated. We have a population of about 2.5 million. And in the greater Albuquerque area, we have about 1.2 million people. I'm an interventional cardiologist at the university hospital here. We have 600 beds. And we have altogether across the entire state of New Mexico, as of yesterday, 1,000 COVID positive patients.
So quite a burden, yeah. Tell us about how does this affect your practice and your normal cardiovascular service?
So this has been a very, very difficult situation for us in the hospital. We are a 600 bed level 1 trauma hospital. In Albuquerque, we have 80 intensive care unit beds, and we have 150 ventilator machines available. So right now, the situation in our hospital is that we have 50 patients in-house. Out of the 50 patients, we have 25 in the intensive care unit, and 12 patients are on ventilator machines right now.
And the same for you, Pedro. Are you still, your referral center, are you still performing elective or semi-urgent cases, or is all of that stopped temporarily?
The difficulties in defining what's elective in cardiology, William, it's not very easy sometimes, but yes, we have decreased to schedule patients very elective. We don't do that. There is a lockdown mandated by the government. Only some things are open, so you don't see people in the streets. The shops are closed. Hospitals, of course, are open, but we tend not to schedule elective patients. I forgot to mention that although the peak is yet to come in the country, but our curves seem to be a little bit flat. Less than what you saw in Europe. Maybe because of the streets, so perhaps we'll have less cases in the country than we expect to have. But yes, the routine in the hospital is completely different.
Mm-hmm. Okay, well, that's good to hear that at least you seem to be in control of the situation, even though the burden is very significant, right? Yeah. Have you stopped the outpatient clinic, or do you still see patients? How does that work?
We still see patients, but you see, the volume is decreased because people somehow they don't come to the hospital unless they don't really feel bad. So there is a clear decrease in the procurement of patients to the hospital.
Mm-hmm. Thank you. I'm turning to Nestor again. So do you know a bit more about the situation in the western part of the USA, or is it about the same situation, say in California or in other states, like in your environment?
Yeah, I think so. For the most part, I think that the state that has been greatly affected in the western part of the U.S. is California, and predominantly the larger metropolitan areas of San Francisco and Los Angeles.
Okay.
So, yeah. Going back to Pedro's comment in regard to the outpatient part of our practice, so we completely shut down the outpatient clinic, and we're doing a program, a telemedicine program that has been very successful.
Oh, so that's good. So you keep contact with your patients, and you can identify the ones that are not doing well, and those you would call to the hospital then if procedure is needed. Yeah, great. Well, thank you very much, Nestor. Is there something from your experience or that you would like to share with the community, and that colleagues in the world you would like them to know about?
I think that social distancing is really making a huge difference in this coronavirus epidemic. So we're trying to follow the rules and regulations and try to adhere to the protocols the best we can. And obviously, we're trying to keep our patients, our families, and our loved ones safe and healthy for the time being. We haven't seen the worst part of this coronavirus epidemic. I think that the peak here in New Mexico is going to be April. We projected it's going to be April 18th until the 23rd. So we are hoping to increase our ICU bed capacity from 80 to 200 if required. But I think it's, at the end of the day, it's all about prevention and protection.
Mm-hmm. And a few words, Pedro, about Brazil and perhaps Latin America in general. What is the forecast? Are you worried? And maybe if you want to share a statement from your experience with the colleagues, we'll be more than welcome.
Yes, William. I think that somehow we were lucky because we were hit. After Europe and China, so we got ourselves somehow prepared, and I feel that we are more prepared now. Temporary hospitals have been built all over the places. We have to protect ourselves and the professionals that work with us. So we need a flow to a pathway to take care of patients with COVID positive, but we should not forget that we also have patients coming to the hospitals with MIs, which are not COVID, and we have also to protect these patients. So we should avoid patients coming to the hospital without COVID to get COVID in the hospital. We need two flows, we need two pathways. And that's actually what we are doing right now in the hospital, establishing two pathways to protect those with and those without.
Well, thank you very much. It gives us great pleasure to have news from you, and keep safe, and also let's stay in touch. Thank you very much, and keep doing the hard work. Thank you for all your efforts.
Thank you, guys. Thank you. Bye.